These are really scary times in healthcare. The coronavirus is now present in every state in the United States, and what you would expect would happen, patients who are affected are arriving in hospitals, in emergency rooms, and some of the more severe people being admitted. This has caused a serious conundrum for patients who were having or plan to have elective surgery this year. Hi, I'm Dr. Dan Lieberman. I'm the medical director of Phoenix Spine and Joint. I wanted to let you know that Phoenix Spine and Joint has made the decision to stay open during the pandemic. Many of our patients who require surgery either can't wait because they have neurological problems, which will get worse if their surgery is delayed, or frankly, they're just in agonizing pain and can't wait it out for several more months. Since we are open, I wanted to show you the precautions that we're taking to make sure that everyone is absolutely as safe as possible when they come to visit us here at Phoenix Spine and Joint. This is the staff entrance to Phoenix Spine and Joint Scottsdale. This is where the nurses and the surgeons and the medical assistants come in the morning and leave in the evening when they're done with their jobs for the day. It's not just patients who we ask to sanitize their hands at Phoenix Spine and Joint during this COVID epidemic, and actually in regular days too. It's the staff as well. Amber, what are you doing for patients as they walk into the center now with regard to the coronavirus?
Hand sanitizer to cleanse their hands, and then we take their temperature with our thermometer. If they are experiencing any cough or sneezing, then we offer them a face mask.
Tammy, what are you doing in your area, the recovery room, to make sure patients are safe?
Well, we're keeping the patients 6 feet apart. We're allowing one family member to come back at a time, and we're using hand sanitizer in between each patient. We're wiping down the surfaces regularly, just making it a healthy, safe environment for ourselves and the patients and their families.
So where are you from?
Actually, I'm from Hannah, Alberta, Canada.
Very nice, very nice. So you guys weren't afraid of a little coronavirus, huh?
You know what? We're not taking it lightly at all. Coronavirus is something that does have to be taken very seriously because they are shutting our country down back home, basically.
Pain from arthritis in the knee is something that has to be taken seriously as well, too.
You know what? I've been very fortunate. I don't have that, but yes, my wife has gone through a lot of traumatic things in the last 3 years.
Yeah. What are you looking forward to the most as she gets better?
Her smile back. She's a happy-go-lucky lady, and seriously, she had her hip done here a year and a half ago, and it was like a godsend. It was amazing, and I'm hoping this will finish it off.
I'm sure it will. Nice to see you.
You bet. Thank you very much.